The standalone option is truly that. You are just going to reshop your Part D plan. You never reshop A and B. You picked your Medigap plan in this quartet scenario. So on November 1st, you're just reshopping Part D and you're looking for some key ingredients. The first is, are your drugs still covered?
Welcome to Decoding Retirement. This week, we are focusing on one of the most important times of the year for retirees, Medicare's annual open enrollment period. It runs from October 15th through December 7th, and it's your chance to make key decisions about your coverage. In our last episode, we talked about how to review your annual notice of change. Today, we are taking the next step with a simple step-by-step guide. Think of it as a checklist you can use to decide whether to keep your current plan, switch to a new one, move from Medicare Advantage to Original Medicare with a Medigap policy, or go the other way from Original Medicare with a Medigap to Medicare Advantage. To walk us through that rubric, I am joined by my good friend, Marcia Mantell, president of Mantell Retirement Consulting and author of several books, including Creating Your Medicare Recipe. Marcia, welcome.
Thank you, Bob. Thank you so much for inviting me on.
It's a pleasure. So right now, millions of Medicare beneficiaries are wondering how to go about whether to stay or go or switch or not. And you've created a rubric, and I would love for you to sort of start from the beginning.
We're talking about all of the people who have already made their most important decision, really. They've picked their lane. And there are two lanes. You can either have chosen Original Medicare with a Medigap and a standalone Part D. I call that the quartet, because you have 4 individual pieces. Or you chose the trio, and that's where you have Medicare A and B, but you've assigned them to the insurance company for a Part C plan, and then the Part D plan comes wrapped in with Part C. So it's this time of year, you mentioned the annual open enrollment period is so critically important because you need to reshop your Part D plan, whether it's in the quartet or the trio. And if you have Part C, a Medicare Advantage, you also need to reshop the medical insurance side of that. So that's what gets increasingly complex, not only this year, but certainly every year that you get older.
Every single year. So before we move on to the specifics of the rubric and the guide, I want to play a clip from Dr. Oz, my recent interview with Dr. Oz, the administrator of CMS, and he was talking specifically about Part A. I would love to get your reaction to that. I know you recently enrolled, I believe, in Part A in Medicare. Is that right?
Very. Yes, thank you for clarifying that. I enrolled in Part A because I have health insurance that you're paying for.
That's creditable, right?
That's correct. But Part A, you should all sign up for. It doesn't cost the government anything because if you have other insurance, the Part A will be in the background.
All right, so let's pick it apart. It's half correct and half not correct. So the part that's correct is, yes, we've all been paying into Part A with our FICA taxes, and it goes into the HI, Hospitalization Insurance Trust Fund of Medicare. So that part is correct. The part I take issue with is not everyone should sign up at 65. That is not a hard and fast rule anymore. And it was with the introduction of health savings accounts and high deductible health plans. As the healthcare industry moved to consumer-driven healthcare, we're the consumers now, and we've got to drive the bus. So if you have a high deductible health plan, you're still working, your spouse is working, and you're covered under a large group plan, 20 employees or more. You have health insurance through that company. It's a high deductible health plan. And you want to save in an HSA because it's triple tax advantaged. What happens once you turn on any part of Medicare, you are no longer eligible to make any more HSA contributions, nor is your employer. So you're losing a really valuable employer benefit if you just willy-nilly jump into Part A without doing your homework.
Yeah, so much misunderstanding about Medicare and Social Security for that matter. I mentioned at the top of our podcast that the open enrollment period runs from October 15th through December 7th. Where do folks need to go when they think about reshopping their plans? Do you want to walk us through that?
Yeah, sure. I have two bits here that maybe will help people. for all the clients that I work with, I let them know it is a 7-week open enrollment period. For you, it's November 1st. And where you go to see all of the possible plans open and available to you in your zip code and county is Medicare.gov. The website and the database they have is really tremendous. It is your go-to. It's really the only place you need to go to in most cases so that you can see the full range offered to you. Then if you're using a broker or an agency, you can also work with that broker or agency, but now you know. You know all your possible options. So go in fully armed, and it will be a much less daunting process.
All right. Now, I know most people have Medicare Part D through maybe a Medicare Advantage plan, but a certain millions of people have Part D as a standalone drug plan in addition to Part A and Part B. How does someone go about knowing whether that's the best option for them?
Yeah, the standalone option is truly that. You are just going to reshop your Part D plan. You never reshop A and B. You picked your Medigap plan in this quartet scenario. So on November 1st, you're just reshopping Part D and you're looking for some key ingredients. The first is, are your drugs still covered? And these are prescription drugs that your doctor or your healthcare professional has prescribed for you. Are those drugs still covered on the plan you have today that you picked for this year? Was it valid next year? Do you have new drugs that you're all of a sudden taking? Are they covered on that same plan? But most critically, what's happened with the pharmacies? Pharmacies move in and out of, I call it status. It might be called something else, but are they preferred in network? Are they just in network? Or are they out of network? And just because they were preferred this year does not mean they are preferred with that insurer this year. So this is why this tool on the Plan Finder or Find Plans tool on Medicare.gov, it's so powerful because it puts all of that together. You load in your drugs, your zip code and county, and it delivers the answers so that you can see the Part D insurance plan that is the least expensive overall, combining premiums and your drug costs. And it lets you know if drugs aren't covered, and you can pick a variety of pharmacies to see, is the one you prefer still preferred? It doesn't matter whether we think it's preferred, it has to be labeled as preferred, where you typically get the lowest possible costs. You don't want to pay more for your drug plan than you have to.
Right. You know, you and I have talked a lot in the past about how just overwhelming this can all be for folks. So let's add another complexity. Some folks have a standalone Part D. Of the 30 million of people who have a Medicare Advantage plan and Part D, they have to go through that as well as other steps to figure out what's best for them.
You are exactly right, Bob. Now, you also do this you start on Medicare.gov's Plan Finder. So you can still start there to see what's available in your zip code and county. But you have 4 more steps to go through. And that's why I love that you called this a rubric. You know, like when you're in school, how are you going to be graded? You either need a rubric or a structure, or you need a fairy godmother. So for those in these Medicare Advantage plans or Part C, you do your drug assessment, and then you need to see if your healthcare providers are still in network, which is where you're going to get your best costs. Is the hospital that you prefer still accepting the exact plan, your Part C plan that you chose? Are they still accepting that plan, or are they not? They don't have to. Is the plan still offered even in your zip code? Are your specialists still in? So it's up to you individually to go through each of these pieces of the healthcare system that are super important to you. That's number 2. Number 3 is now we start to get down and dirty with the real cost exposure. So what we always hear, Bob, on the advertising for Medicare Advantage plans is, hey, 0 premiums or really low premiums. That is true, but that's not the end of the story. So what we all need to look at is our maximum out-of-pocket costs that the Medicare Advantage plan that you chose can charge you when you're using the healthcare system. And it has been a steady drumbeat rise moving up the stairs here over the last, probably forever, but since 2020, when I started tracking this, your maximum out-of-pocket exposure was $6,700 in 2020. This year, it's $9,350. Now, the insurer might not charge as much as that for in-network services, but they can. That's the maximum. And it's $14,000 if you go in and out of network using a PPO, a preferred provider organization option within Medicare Advantage. So the bottom line is you don't look at premiums as your metric. You need to look at your total out-of-pocket cost exposure. That's number 3. Number 4 is more cost. How have your copays changed? The place where people get tripped up with Medicare Advantage plans, you typically have to pay the first days that you spend in the hospital. It used to be sort of standard. You either paid for the first 3 days, 3 nights, or the first 4. This calendar year, 2025, it went up to 5 in many of the plans. So will it be 6 next year? I don't know. We have to look through the plan document to find out. So you have to look for the copay changes, the differences between in-network and out-of-network options and specialists versus your PCP. All these cost pieces fall on you to figure out. The last piece is number 5, what I call the extra goodies. A lot of times people choose Medicare Advantage plans because they like the idea that they'll get some dental coverage, they'll get some eyewear, $150 towards new glasses or $500 toward hearing aids or something like that. Well, those benefits are optional benefits and they can change every year. And your providers can decide not to accept your plan. So it's a lot of phone calls to make on November 1st to see who's still in the plan and is it still the best one for you. So, get ready. I'd get a cup of coffee, get my phone.
Get a pot of coffee. Marcia, we have to take a short break.
Yeah.
And when we come back, we'll talk about the key differences between these plans for at least in 2025 and what people can expect in 2026. So don't go away. Welcome back to Decoding Retirement. I'm speaking with Marcia Mantell. She is the president of Mantell Retirement Consulting. And we're talking about a rubric to help you decide whether to switch plans, stay in your Medicare plan, or do something else like leave the country. I don't know, Marcia, maybe something like that. But when we took a break, I said that we would come and talk about these key differences between plan types, between Medigap, between Part C HMO, Part C PPO, and then given those different types of plans, how you might decide which is best for you. Where to begin?
So, Bob, I struggled with that, as I'm working with individuals and trying to explain, because that's the number one question is, can I still contribute to my HSA? But the second is, how do I decide? And the advertising is so slick and so compelling to go with these Medicare Advantage plans. People often come into a meeting with me and go, I think I'm supposed to have a Medicare Advantage plan or a Part C plan. They don't even know there are options, HMO, PPO, HMO, POS. There are special needs plans for certain conditions. So there's a lot. And for me, the way I could structure a decision-making guide, if you will, is on one page. What really are you expected to do? If you have a standalone Part D plan and a Medigap, here's what you consider. And if you have a Part C plan, well, which kind? And what do you have to consider? And what it comes down to is not about the premiums. It really has nothing to do with the monthly premiums, to be honest. Over the course of your retirement, you're going to pay about the same if you get the same kind of sick that most older people get, right? So it's about how involved do you want to be? How many times do you want to read that annual notice of change? Because I know you don't read it. How many times do you really want to dive into the big 168-page plan documents and read what you're really signing up for? How many times do you want to fight with the insurance company because they deny care that your doctor has prescribed, or the drug that is I'll call it the fancier drug, because the generics don't work for your specific chemistry and situation? You have to be in for the fight. Maybe you're willing to fight at 70, 72, 75. You're not going to be fighting at 80, 85, and 90. You will not win those battles. So this is about level of involvement, total exposure of costs, those maximum out-of-pocket costs, and lack of flexibility in my book. Then there's premiums. Yeah, it's on average $150 to $200 per person per month across most states right now this year. You can get some $0 Part C plans, but $0 is never zero money.
Yeah. So you
Hopefully it
talk
helps.
about being savvy. If someone wants to make a change, there are all these rules about switching between, as we said at the outset of this podcast, between switching from original Medicare back to Medicare Advantage or from Medicare Advantage back to original. But there's some rules of the road that people need to know about.
There sure are. And nothing's easy, simple, or straightforward in Medicare land. So during this open enrollment period, what you can do is you can switch your Part D plan. When you have a standalone plan, you go from cheapest version this year, and there'll be a different one, cheapest version next year, switch to the new plan. That's easy. If you have a Part D plan in the Medicare Advantage plan and it no longer covers your drugs, or you found a better option, you can switch between and among Medicare Advantage plans. Not a problem. What you can't do in most states, you cannot have today, you pick the trio, and let's say you've had Medicare Advantage for the last 8 years, you cannot, contrary to what people will tell you, go to original Medicare and automatically get a new Medigap plan. You now are subject to medical underwriting, and the Medigap insurer is going to decide whether they let you into the party or not. I mean, you're 8 years late to the party. They don't need to let you in. And the reason a lot of times people want to switch from Medicare Advantage back to original Medicare with a Medigap and a standalone Part D, you want the flexibility. You want the specialty hospital. Now you're sick. Well, now that you're sick, you haven't prepaid. You haven't played by the rules of the insurance game. So you can be denied coverage by any one of the Medigap offerings in your zip code. But often what will happen is you're going to charge more, or you need to wait 6 months before the problem that you now have will be covered. So you've got basically 6 months with a gap of insurance, which is not going to be helpful to your wallet. So you can't just decide that you want to make changes. You have to play by these rules, and they're rigid.
So for folks who are not yet enrolled in Medicare, your recommendation might be think about Medigap right from the get-go, as opposed to thinking about it years after the fact, where you might not be able to qualify to get into a Medigap plan.
Yeah, in all but 4 states, you are essentially making a 30-year decision. If you look at retirement as a 30-year window, which we do, and hopefully we'll all make it 30 years, you are making your decision in your mid to late 60s, depending when you're actually joining all 4 piece parts of Medicare. You're making a 30-year decision. Now, there are 4 states where we have what's called continuous open enrollment. So Massachusetts is one of those states. We can come and go kind of as we please, as you can in New York, Maine, and Connecticut. That's it.
In some cases, the number of Medicare Advantage plans, especially in like rural areas, may decrease even further from the small number that are offered in those places at the moment. What advice do you have for folks who are sort of in these places where they're witnessing a declining number of providers and options?
Do your homework, do your research, find out what is happening and maybe why your particular area of the country is not supporting, certain Medicare Advantage insurers. Make sure you don't miss the opportunity to get into a new one. If the one you have today is leaving your area, get into one. Make sure you have continuous coverage. But on a higher level, what can we do? We need to be much more involved with Congress. We need to be really kicking and screaming on the phone, calling our representatives in the House and our senators and letting them know if you are in areas where your health care options are being cut back, you need to be yelling and screaming because there just is no other alternative right now.
So what advice do you have for retirees who have chronic health conditions? How might they prioritize, this rubric when reviewing their plans during open enrollment period?
That is a really good question, Bob. That's one I've never gotten before. It's look at all of your options still. And that's why I go back to the plan finder over and over because you're going to see everything available to you. So certain chronic conditions, there are smaller extra goodies available in some Medicare Advantage plans. Things like transportation to and from doctor's appointments. That's not an ambulance. You might get some dollars back for using a ride share or something like that. That might be important to you if you need to have some additional help with mobility and getting to your appointments. Look for community-based. I love, as you know, and you're very involved in your COA, your Council on Aging. The Councils on Aging, the SHIP representatives, the State Health Insurance Assistance Program, these are free resources. Your local library may have people who are knowledgeable about what's available in your communities. You might have to patchwork this together. You have only maybe a few Medicare Advantage plans and a few Medigap plans to choose from. You make your choice. But then you might need additional services and help around the community. There is a lot out there.
All right, last question. So we know that the vast majority of Medicare beneficiaries don't switch their plans. Inertia gets the better part of them. So are there situations where it might be better for them to do nothing and simply stay with their current coverage?
They would have no idea, Bob, if they didn't shop.
Yeah.
It's a stunning amount of change. I was trying to think of a way to explain this better. And I'm thinking for sports analogy, like this year, let's say the insurance industry is playing baseball. And then in 2026, they're going to play volleyball, but they're going to use football rules to play volleyball. We don't have any idea. We don't get to see what's behind the curtain, until October 15th, when we go in and start reshopping our plans. You don't know unless you go into the belly of the beast.
And that could cost you thousands of dollars in unexpected costs that you weren't anticipating. So, Marcia, I want to thank you ever so much for sharing your step-by-step guide, your rubric with our listeners and our viewers. It will be extremely helpful and valuable to millions of Medicare beneficiaries. So thank you.
Thank you, Bob. I greatly appreciate being here.
So that wraps up this episode of Decoding Retirement. We hope we provided you with some actionable advice to help you navigate Medicare's open enrollment period. Coming up tomorrow, we'll talk with Tricia Newman from KFF about Medicare's Plan Finder, how to use it, how to find trustworthy persons to help you select the best Medicare plan. And remember, you can listen and subscribe to Decoding Retirement wherever you find your favorite podcasts.
This content was not intended to be financial advice and should not be used as a substitute for professional financial services.